Did you know that you have a 20% chance of having an elevated genetic cholesterol marker that increases your risk of heart attack and stroke? Well, today we're going to talk about one of the most important cardiovascular risk factors that you've probably never heard of. We're talking about lipoprotein A or Lp(a). Do you know your numbers? Well, if you do, it may just be life-saving for you and for some of your family members. Today on Living Heart Smart.
Matt, we're at a really great time right now. We've known the special cholesterol marker can lead to increased risk of heart attack and stroke. We've known about it for a long time, Lp(a). And it's been on the back burner for a long time because there's nothing we had to do about it. But we knew it was still back there, and it's back in the spotlight again. Hit the news.
Well, as Carolyn, as you know, we're trying to keep up with all the latest cardiovascular news and bring those podcasts to people right away because there's so much good information coming at us. And even a week ago in the New York Times, there was a new article related to lipoprotein (a) called
There's Another Risk to Your Heart.
Yes.
That's getting new attention.
I couldn't remember that. Yes. So people are starting to hear about it. So we're excited. There are at least three good reasons for us to want to know what the Lp(a) level is. Number one, this is a silent marker of cardiovascular disease. You don't know what you have until you check it. Number two is if you have an elevated level, since this is purely genetic, you should have your siblings screened and your children screened to see if they have elevated levels. And third, and maybe most importantly, is there are new medications coming. We finally look like we're going to have medications that target lipoprotein A specifically and potentially can bring those levels down by 70, 80, 90%. So this is a great time for us as cardiologists to be looking for these levels. And for all our patients out there and for all of you, make sure you know your lipoprotein A levels. Dr. Lacey, if you can just, let's take a step back for a second. We talk about cholesterol all the time like everybody knows what it is. So can you tell us what cholesterol is and what this lipoprotein A is?
Let's talk about cholesterol first. Cholesterol is a really important molecule all throughout our body. For instance, it's 40% of our cellular membrane, so the lining of the cells that keeps everything inside, 40% of that is made up of cholesterol. It's really important as a precursor for making all of our steroid hormones that our body just makes, changes how we create vitamin D when we're out in sunlight, and it even is used in the liver to help create bile acids. And bile acids are really important to help our digestion and help absorb fats molecules. So
cholesterol is super important. We all need it. So cholesterol gets this negative rap because we're always treating and lowering and all this stuff, and it causes potential problems. But that's just the way things have gone when you get way too much in your system.
The other thing we need to understand is that cholesterol, it's not a soluble molecule in water. So in order to transport it all throughout the body, your body has to make these proteins, and they're called lipoprotein particles, and they travel through the blood to get the cholesterol to the areas where it needs to be used. So these lipoprotein particles are essentially these spherical packages of cholesterol. That's how you can think about it, that are moving around fats in the body. And Lp(a), the apolipoprotein (a), is a specific lipoprotein that you can really think about it as LDL cholesterol's sort of dangerous cousin, right? It's particularly sticky and inflammatory.
I think of this little extra particle sitting on your lipoprotein, your cholesterol molecule is sitting in there. There's more likely to want to get into your arteries and start setting up camp and causing problems.
Right.
Yeah.
So lipoprotein (a), LDL's angry, crazy little cousin, it's one of those things that it's purely genetic. It's really one of those things that we think about our cholesterol as being influenced by our diet and our lifestyle and our exercise, etc. But Lp(a) is not.
When you think about 1 out of 5 people having this marker and they don't know about it, 20% of people have elevated levels of lipoprotein (a). That's a huge amount of Americans alone that have this number. And sadly, up until this point, only about 1 out of 100 people are even screened for it. So we're still missing a huge population of people that have this elevated level. We're getting there, and I think things are coming. It's better than it used to be. We're talking about it. That's always a good start as well.
Right.
Okay, why do we care? If this number is elevated, what does it do to our body? Why is it bad for the cardiovascular system?
So remember, I already said that it's really sticky and inflammatory. So,
Yeah.
and this lipoprotein is going to start to get into the walls of the arteries. And it doesn't matter what arteries. It can be in our heart. That's coronary artery disease. That leads to heart attack. It can be in our brain. That leads to stroke. It can be in our legs or to other parts of our bodies. And so
Yeah.
that's peripheral arterial disease
Right.
that we're talking about. And it can even be associated with aortic stenosis.
Yeah, I
Did
think
you know
that's
that?
relatively new.
Yeah.
Aortic valve is in the heart. It's one of our 4 valves, and it's kind of prone to get calcium on it, which leads to restriction and stenosis. And we're finding a strong correlation between this calcification and elevated lipoprotein A levels.
It actually turns out that people that have elevated Lp(a), they have a 3 to 4 times increased risk of having a heart attack. And that's even when everything that we know to test for right now,
Yeah.
the blood pressure, glucose, cholesterol, even when all of that is normal, they
Yeah.
still have a much higher risk.
Yeah, it's what we call a residual risk factor. So take all our traditional risk factors that you just mentioned, and then what else is there? Because some people still have events despite the fact that we've either treated those numbers or those numbers are normal. So we're finding these extra markers, and lipoprotein A is a classic one now. And I think, Carolyn, I'll just mention cardiologists, we look at prevention in 2 different ways. So the question is, people are going to have, okay, my level's elevated, now what? Well, we're going to put you kind of into one of 2 main categories. The first one's we call primary prevention, which means you have never had a heart attack, you don't have any major blockage in the arteries, you haven't had a stent or anything else. So primary prevention means we're trying to prevent that first event. So if you have an elevated lipoprotein A and no other events, excellent. Good to know that you've got it. So now we can start tackling things aggressively, lowering your LDL, which we can target, and all the other risks that we mentioned. The other person out there hasn't already had a heart attack or stent or bypass or something like that. And now we're checking the lipoprotein A levels and it's elevated. How does that change treatment? Well, not as much in the secondary prevention model because we're already being super aggressive in treating everything. I think for a lot of those people, it's just another one of those things that we need to know about. So when these new medications come along, we're going to be on top of it and get you the best medication we can to keep your risk nice and low.
Matt, I really did actually like how you described that primary and secondary prevention. I know, comes as a shock, right? Not just, I do agree. Woo.
Yeah, thank you.
So let's move on. Who should be tested for elevated Lp(a)?
Let me say this. Who shouldn't be tested? Maybe that's a better question we should be asking, right?
That's probably a better question.
I think so, because guidelines, I think, are a little bit behind. We try to follow the national guidelines of what tests we should order, what prevention models are out there. I think what we're seeing is that everybody, all adults, in my opinion, I think you agree, should have their lipoprotein A level done once. Get it done one time.
One time.
That's my recommendation. Everybody that I see is going to get a level.
I'm doing the same. When I'm seeing people in the office, I'm starting to order much more routinely the lipoprotein A.
And a list of, I've got over 150 names on the list of elevated lipoprotein A levels, so that when the time comes and medications are here, boom, we're going to be on top of it. So make sure you get your levels screened.
So there are medications that are in the pipeline. They've been being studied for the last several years. Right now, there are injectable medications that are coming in the pipeline. And and they've been showing really
amazing,
really promising results. 80% reduction in LDL, or I'm sorry. I'm so used to saying LDL.
It's always been LDL, right? That's been our baby.
Right. But now 80% reduction in Lp(a), whereas before we never had anything that changed the mark on Lp(a). But they're just the injectable drugs. Matt, are there any pills that are coming down the pipeline?
What an interesting question. Yes, thank you for that. Interestingly enough, there are new oral medications coming as well. In fact, at our clinic, we are going to be studying one of them that are coming out. Hopefully, we'll start enrolling people this fall. I'll be the primary investigator of that trial here locally. And then when that is available and we have more data and we start enrolling patients, I'd love to do another show to talk about that medication that's coming. But thank you for teeing that up for me. I appreciate it.
Yeah, there you go.
So new meds are coming, new trials are coming. But what can a patient take away from this episode? What's the key takeaway?
Matt, I think our call to action is If you don't know your Lp(a), get it tested. Know your
Perfect.
number,
Yeah.
right? If it's normal, you're done. And if it's abnormal, then you can start talking to your doctor about what your next steps are. Even if you can't treat the Lp(a) directly right now, we all can do a little bit more work on just being more aggressive with the things we already know what to take care of.
Yeah, I think that's exactly right. Let's keep it. The message is simple today. Get your level checked, be done with it. Talk to your doctor if it's elevated. Also talk to your siblings and your children if it's elevated, since this is genetic. So really game-changing stuff coming. It's going to be in the news. Keep an eye out as these trials progress.
We hope you learned something today listening to us talk about how we use Lp(a) in our own practice, and keep listening. There will be more to come on all things cardiology.
Yep. And send us your comment and your feedbacks on other topics you'd love to hear about. Thanks so much, and stay heart smart.
Thanks for listening to Living Heart Smart today.